So you touched on value frameworks before. Can we talk a little bit more about those for a moment? I've heard them described as a symptom of a bigger issue. So what does that mean to you?
Well, in a sense, I'm not sure exactly what people mean, but they may mean that the bigger issue is the healthcare cost issue in the United States. And as healthcare costs continue to rise faster than overall GDP, it means that we're spending less money on non-health issues, and we're facing real challenges as a society to continue to pay for things that people want in healthcare. And it's intensified or aggravated by the fact that the population is aging, that and people want these things, and there is some really good science bringing ever more useful innovations to patients and society. Now, underneath the health cost issue, there are drivers of spending. One of which is pharmaceutical spending, but it's only one. Pharmaceutical spending, depending on how you define it, it's probably 15 to 18% of total health spend. Most of health spending is driven by spending on doctors and hospitals. So if we're going to, again, be honest about the spending problem and the value issue, to get back to it, we should be thinking broadly about where the money is being spent. There's certainly a lot of attention on pharmaceuticals, and that's driven by real concerns and real needs on the part of payers and others for information on value. So it has stimulated groups. One is the Institute for Clinical and Economic Review, ICER, that's gotten a lot of attention. There are others who have developed methodologies to measure the value, mostly of drugs. They do look at other areas, sometimes devices and sometimes health services for, say, low back pain and such. But a lot of the attention has been on drugs. And why that is, well, drugs are an easy target in a sense. There's an identifiable product. There's a FDA approval process that delivers a new product to the system where payers have to make yes-no decisions or yes-but decisions in terms of how they cover. And so the need for a very specific action and the value or the benefit, I guess, of a value framework is more readily apparent, perhaps.